Thousands of Americans live with chronic pain, and they don't even realize it often that there are options for treatment. Dr. Todd Joy joins me now. How prevalent is it for people to be living with chronic pain?
Thank you, Debbie. That's a great question. Chronic pain is a very complex and common problem. Up to 75% of Americans have experienced chronic or recurrent pain.
Wow.
Or have a family member who have experienced such pain.
How do you define chronic pain then? Is it something that just keeps coming back and you don't get rid of, or what?
Classical definition is pain that's been there for 6 months or longer. Obviously, pain's a good thing. It causes you to see the doctor, but once it's been there for a long period of time, past the expected length of recovery, they need to seek help.
This time of year, a lot of stressors during the holidays often, and we think that we want it to be warm and fuzzy. So do you see it more often in the holidays?
This is a very difficult time for a lot of people suffering with pain because the symptoms often get worse. We're overextended. We're expending huge amounts of energy to prepare our hearts and our homes for family and friends. We're cooking, shopping, cleaning. We're coping with the loss of loved ones. We're closing out the business books at the end of the year. We're traveling. So it's a perfect storm. And on top of that, the weather usually gets colder, and that makes things worse.
Wow, so a lot of people just say, I'm just going to live with it. But I guess for Christmas, a lot of folks would like some relief from it. So what do you do?
There is relief available. Now, if you're treating pain, you usually think of it as climbing a ladder. When you have a problem, you're going to take the first few steps to get better. These are usually non-medication techniques, physical therapy, exercise, rest, those type things. When those don't work, you climb the next step, and that's usually medication. If that doesn't work, people think, I have surgery or I have to live with it. There are steps in between that before a patient has to make that decision, and that's where interventional pain management falls into play, where folks can be candidates for diagnostic nerve blocks, radiofrequency ablations, even this amazing device called spinal stimulation.
Some people may say, I don't have time for all that, but if they put it off, can it get worse?
It can cause severe problems down the road. It can cause sleep deprivation, malnutrition, social withdrawal, physical and functional decline, anxiety, depression, and even cognitive impairment.
Well, thank you very much, Dr. Todd Joy, for being with us.
You're welcome.
We hope to have you back.
Thank you very much.
Thank you.
Coming up, women often end up paying